everyone, my name is Cassandra, and today I'll be talking to you about the pros and the cons of cochlear implants. So before we get into what a cochlea is and what cochlear implants are, I want to take a step back for a minute, and I want you to imagine that you're having a face-to-face conversation with someone, whether it be a family member or a friend. So you kind of know how a regular conversation goes back and forth between two people listening and speaking. So what if you were to stick both of your fingers in your ears and try to have a conversation that way? So kind of imagine, the only thing that you can hear when you plug your ears is yourself speaking. It's a fuzzy voice inside your head that you can't really hear anything else, especially the person that you're trying to talk to. I want to kind of imagine this because that's kind of what a person with hearing loss goes through on a day-to-day basis. They can't really hear the sounds around them or communicate effectively with another person because they can't really hear it all. So you might be asking, what is a cochlea? A cochlea is an internal spiral organ that's located in your inner ear by your eardrum. And what it does is take sound vibrations and turn them into nerve impulses that allow you to hear. When the cochlea becomes damaged through things such as congenital defects that people are born with, loud noise damage, accidents, and illnesses where people don't take care of their ears, and things like infection set in, then the cochlea becomes damaged, and that's when people experience the hearing loss. So what is a cochlear implant? The implant has two components to it, an external and an internal component. The internal component is placed through a surgical procedure. The surgeon cuts a slit behind your ear, and it has a little component that has a wire that is connected into your internal ear. It's threaded in there, and then the external device is connected through a magnetic device to the internal component, and that's what makes up the implant. What the whole device does is it creates an electrical field, and then the auditory nerve is stimulated, and the sounds are converted to electrical current, which allows you to hear the sounds like you would before you had the implant. And the implant makes people's lives a lot easier if it works for them. There's also risks that people can go through after they have the implant done, and it's important for a person to talk to their audiologist or their hearing doctor as to whether the implant is right for them, because the implant doesn't always work on people. So today I'll be discussing some of the pros and cons of a cochlear implant. Some of the pros are immediate benefit seen, regaining all or some of the hearing that they lost before, and better opportunities for their education and career. Some of the cons are cost of the implant, maintenance to the implant, and surgery risks that a person runs when having the procedure behind their ear done. The Hearing Loss Association of America said in their article that 188,000 people nationwide have cochlear implants. In 2014, the US FDA said that benefits to adults with cochlear implants are immediate over a period of 3 months. So in that 3 months, they're regaining their hearing, they're hearing better, they can effectively communicate between another person or a few other people, and the benefits can be seen for up to several years after the implant is placed. It's at a slower rate than the first 3 months, but it's still progress to how the person was hearing before. There's also people regain their hearing. They can regain all of it or just some of it, but it's a lot better than not being able to hear, so the implant helps people, again, effectively communicate and be able to hear the sounds around them so that they won't have to lip read when they're communicating with other people, and they don't have a need to learn sign language or for a translator. So they use themselves as resources to be able to hear instead of having outside resources come and help them hear. So as you can see, immediate benefits are a very big thing for cochlear implants, regaining their hearing, but also there's opportunity for career and learning, like the people's education. A person down to 12 months of age can have a cochlear implant, and they say that if children are hearing better, they're learning better. So they have a chance of growing up having a better education when they can hear, and then during their future, they're open to more career opportunities and less discrimination by, say, an employer if they can hear better, and if they can, again, effectively communicate. That's the big picture here. Being able to effectively communicate, hearing sounds, and communicating with other people about what they need you to do or what you need them to do. So some cons to a cochlear implant that need to be discussed before the procedure is done. One thing that the FDA says is that people have a big problem with coming out of general anesthesia. Allergies, sicknesses, things coming out after the procedure. People don't really respond well to the anesthesia that they have to be put under for the surgical procedure for the slit behind the ear. Other things is ringing in the ear, numbness after the procedure, and you may not be able to hear better. It's just kind of a chance that you take, and things based on your current health, age, and the degree of the hearing loss as to whether implants may or may not help you. Also, a cost is another very big con of a cochlear implant, because not many insurances cover the costs of the procedure. Insurance companies try to say that it's a chosen surgery, and people want to hear better, so they're not going to cover the cost of it, which is a very expensive procedure and implant to pay for out of pocket. Also, maintenance to the implant is a big thing, because batteries need changed in the implant. The changing of wires needs taken care of every so often, and remapping of the processor within the implant is an adjustment of the speech that improves hearing for people, but it needs done every so often after it's implanted into a person. So you can see that the FDA recommends or says that many people have problems with coming out of the anesthesia and with different things such as infection and numbness and ringing in the ears that the implant may not help a person be able to hear better. There's a very high cost that insurance companies don't really cover because it's a chosen surgery, and the maintenance, it's pretty high maintenance to take care of the implant in your ear so that you're able to hear better. So as a kind of recap, cochlear implants have many pros and cons to this electronic device that has an internal and an external component. It can restore hearing from losses such as the congenital defects, the loud noise damage, and the accidents, the illnesses. Some of the pros, immediate benefits to the patient. They can regain all or most of their hearing, and there's a better chance for children at opportunities of education and career opportunities. Some of the cons include the cost of the cochlear implant, the maintenance to the implant, and surgery risks that the person runs while having the implant procedure done. So imagine that you have taken your fingers out of your ears and then try to have a conversation again. It's a lot easier. These implants can make people's lives a lot easier and better to communicate with other people, and some people don't really benefit from them. So it's important to talk to the audiologist about whether it is right for you. And I hope that someday, if a family member or even yourself, if you have hearing loss problems, I hope that you're able to weigh some of the pros and cons and be able to decide if cochlear implants are right for you.